Anxiety and depression are the most common mental disorders for adults, really globally, and certainly we know it's very common here in Australia. Traditionally, there are two standard approaches, psychological approach but also pharmaceutical approach. And I guess what we're interested here is what might a body-based approach have to contribute to those two standard approaches. Anxiety and depression are feelings that we all have from time to time, but when they become a disorder, what we're really talking about is when, in the case of anxiety, worry is chronic and disabling. And in the case of depression, what might be a low mood from time to time is sticking around and it's impacting on someone's life. They might not be sleeping as well, not eating, and really finding it difficult to function perhaps in a social context or at work. Here at Deakin we have collaborations with a range of health services, including Bowen Health. We talked about the possibility of introducing yoga as a complementary therapy to psychological work for adults with anxiety and depression. And really that's how the project came about. We now have the opportunity to have adults who come along to our psychology clinic to have a yoga practice, a yoga therapy practice in addition to CBT. And we're looking at what are the benefits of yoga in addition to their usual psychological practice.
So yoga is a tradition that evolved in ancient India many thousands of years ago, and its purpose was to direct the mind into a way that it could focus without distraction. So it's sort of a lead into meditation. So traditionally yoga works with a few different ways of doing that. One way is the body, asana, which is what we use a lot in Western yoga. This use of our body to move into different shapes, work with our breath and so forth. But ultimately the goal of yoga is to direct the mind. So it's coming into a quieter place and a sense of inner awareness ultimately.
A few years ago I did some research projects looking at yoga for chronic pain conditions like irritable bowel syndrome and rheumatoid arthritis, and found that people in qualitative interviews said that they generally felt better, their well-being had improved. So more recently we're interested in developing a yoga program for people with pelvic pain syndrome, chronic pelvic pain. And one of the associated conditions with chronic pelvic pain for many people includes symptoms of anxiety and depression. So we're anticipating that a yoga intervention will help people not only to lessen their pain, but also to help improve their anxiety and depression.
Anxiety is the leading mental health issue for men in Australia, and it's something that maybe a lot of people aren't aware of. Anxiety is a particularly physical mental health issue. It's racing heart, it's shortness of breath, it's feeling like we need to flee a situation at times. What we know with CBT or traditional therapy, one of the barriers there is men being vulnerable and having to talk about their feelings. Yoga is an interesting potential option for men experiencing anxiety because what it actually does is it calms down our bodies, it calms down our nervous system. So we're interested in getting a group of guys into yoga who experience anxiety to see what really calming down their bodies, calming down their nervous systems might actually do for their mental health and their anxiety.
I've been working, getting people involved, collecting data about their mood and well-being before they entered the study and then again at the end. Something that was really kind of consistent was how people found yoga to really help them take on what they learnt in the CBT and offer them a way to practice certain skills at home or wherever they are really to maybe regulate their anxiety or get them to feel a bit more motivated and just a bit better about themselves.
Our participants are telling us that they enjoy the yoga, that's assisting them in addition to the CBT, and that's really self-empowering. And we hope our research will support practitioners to recommend yoga therapy as part of their clients' overall mental health treatment.